You know, and like I said, I feel a little bit uncomfortable when you mention about we got to watch how we spend our money on the disaster funds. Like you mentioned about Israel, you mentioned about the lava flow. But to me, any of these cases is an emergency. And to me, you cannot restrict by saying which one is more important. So I'm going to save these funds for this most important thing. It showed in the past how the state operated in their agriculture and the health department with all these invasive species, right? We had a cutback on all these inspectors and so forth. We didn't have vector at one point, you know, and with like the fire ants, the cookie frogs, it just expanded. And why? Because they didn't want to spend the money. And look who's now hurting is this big island, right? We're infested with fire ants. We're infested with the cookie frogs, and the nettle caterpillar or whatever, and all these other stuff, right? And the investment, to me, if you can do it quickly and early, then you don't have to prolong it, and it might not grow. So to say that we need to watch how we spend our money, I don't think so. If this is a problem, this is a health problem, we need to invest whatever resources or funding that we can use to fix it, because the people is the one that are going to get hurt. So to me is open it up, and like for example the catchments. You know, I don't know how much percent of catchments are on this island, but if we can spend maybe like couple thousand or at least $1,000 or $500 on each catchment to get it upgraded to where we go and destroy whatever, you know, those babies or whatever in there, and make it, you know, at least suitable where they won't be able to breed again, then to me we at least succeeded on that part, right? And then after that, the resources about like getting more vector control personnel. I mean, Eric, how long will you think that will take to get this staff on board?
Well, currently, right now, it's going through the approval process. It's with our administrative service office in Honolulu.
Okay.
And I think once it goes through ASO, it goes to the human resources.
Right.
And then from there, we get the notification that we can fill.
So maybe another 2-3 more months, maybe.
No.
1 month?
We're looking,
because
hopefully, we're going to have all 8 positions filled and start at least by April.
Okay. And so I know the county, we have some personnel that's in Parks and Rec that we had gotten funding to do our fire ants treatment, right? And I heard that they are working, I guess, on the weekends with the state. Now, to my understanding is, but if we could get them, and this is where you come in, Chief Oliver, that if we could get them permanent and into their title, which is a vector control personnel, that they could be utilizing, the state could be utilizing them for more personnel at this time until they get their manpower, correct?
Yes, and I'd just like to correct. I guess we're not in any shortage of qualified, trained county employees to support Vector. We've had over 90 public works people trained as well as parks. So there hasn't been a shortage of county staff to support Vector.
No, but I'm just saying utilizing whatever manpower we got, because like I said, if we are declaring this an emergency, then we should react as it is that it's an emergency.
Correct.
Right? And not go as long as, okay, we don't have any reports, okay, we kind of mellow out or whatever. But it's like, let's just treat everything. And then, like I said, utilize the funding. I mean, to me, it's a major factor.
And right now, I think we're trying to identify that with the entomologists so we have long-lasting benefit from what strategies we take rather than a short-lived one. Because the response, we're taking the short approach, which is let's take care of the infected mosquitoes and knock them down. Long-term, it's how do we maintain the environment by reducing the vector. And as examples you mentioned with the Parks and Rec employees, in speaking with Director Hanma, what they're trying to do is look at the parks facilities and how do they establish a maintenance programs within their own inventory of properties that are widely used by the community, which pose a risk. As we saw, Hokena was ground zero, if you want to call it. So going forward, a maintenance program developed by the entomologist that would give, I want to say, a risk reduction for the long term so we don't see a return. So we are working closely with parks. And again, if there's discussions about how to spend the disaster fund, I'm sure you'll be having those discussions with the mayor. Of my role and my job is to provide you with solutions and what those solutions would cost.
It's been how many months already, right? Because look at, like, for us as members with the fire ant problem and the Koki frog, they put contingency funds to have the public purchase the like for the Koki frogs, the citric acid, right? We working right now. We got some funding from from HISC and also from Department of Ag to do the fire ants, to do a program with that, so the public can go and purchase, or get these vouchers to get free pesticides to help treat their places at their property for fire ants. So why can't we do the same with the mosquitoes?
Sure, and I'd be more than happy to continue discussion, I guess, with yourself, the council, the mayor, on recommendations on how we deal with the catchment problem.
No, but see, that's why. I don't want
I don't
to
have the solution for you right now to tell you let's replace everyone's catchment tank, because I think there are catchment tank systems out there that are very safe and functional. I think we need to qualify and quantify what's the strategies going forward with catchment tanks.
And I understand that.
You're saying it was better then to issue an emergency declaration later than sooner?
No, I'm saying that we were weighing it out throughout the response, whether or not we needed it in place to acquire resources at that time.
I think concern on the part of the public, and remember now, I'm from urban Hilo. Really, our concerns are not as great as those in South Kona, those persons in South Kona, Puna, but it's still pretty high. So I can imagine how people in those areas feel. And, I also speak as a parent. I'm kind of concerned for my kids, right? Really, I think what I hear from the public, and I think everyone here will agree, it's not so much what you guys are doing here. You guys are doing a bang-up job with whatever resources you guys have, and we congratulate you and thank you. It's that somehow we get the feeling, and I don't expect a response on this, okay, that the higher-ups in state government are not giving that same commitment or that sense of urgency. And this kind of touches upon it. Where is he? He's gone already. But what Mr. Onishi was saying, by the time that things, like the ants and the koki, because they weren't really addressed early on, it's just gotten to a point where we have to live with it already. And hopefully, we don't, it doesn't happen with the dengue. I have a little bit more time, right? Yeah.
Yeah, if you want to finish up, summarize your questions.
Have you guys consulted with Dr. Cregan, Representative Cregan? Because, he came here during that first go-around, and that's the first time I heard of the Zika virus. He's the one who brought it up, and it was almost prophetic. Yeah, nobody even knew what Zika was, and all of a sudden it's in the public consciousness now. Something more scary than dengue, actually. So I think, given the fact that he was the first one to really bring it up, I think you guys really, maybe, or at least maybe the higher ups in the health department should kind of, take what he's saying to heart.